So today we have Su with us. So welcome, Su.
Hi guys, my name is Sue. I am the founder of Reborn SMP Clinic in London, and I'm very happy to be here today with Dr. Mark Tam.
We've seen so much amazing work that you do, Sue. So welcome and joining us in here. We'll talk a little bit about SMP. I mean, a lot of patients of mine already, when we talk about SMP, they'll say, "Oh yeah, I know, like a tattoo, right?
Yeah.
I know what it is." But that's not the same,
Yes,
isn't it? Tell me about that.
So SMP is scalp micropigmentation. Similar concept with tattoo because it involves needles and ink.
So does this SMP with the needle does it hurt?
Well, no. Like the simple answer is no. I ask all my clients every time I'm doing this treatment to them. They're like, "Oh, I'll rate it out of 2. Out of 1 to 10, 10 being the most painful, they will rate it 2. So they say it feels like a little soft scratch. Some clients fall asleep. I have a lot of female clients, a lot of mums that come in to get this treatment done, and they usually fall asleep during the treatment. This is their only time to kind of relax and
Cool. Well, no doubt if I do my injections, my guys would know. When I do my injections, no one is going to sleep.
Yeah, no one's going to.
Actually, it's quite brave to ask them, does it hurt when I'm doing injections?
Yeah.
I usually don't ask them, does it hurt? Because I know it hurts. My injections are, of course, local anesthetic injections tend to hurt a little bit more.
Yeah.
Do you use like a device to dilate?
Cream.
Yeah. Do you think so? That or
We don't do numbing cream because the outcome is better without anything.
And it's so mild, so probably don't need so much, right?
I do advise clients to take some painkillers if they're really scared and if they're really bad with pain. But even people who are super sensitive, they said they don't feel anything.
Cool.
So yeah, it's very
cool,
very easy, very quick. Very.
So the ink is brought into the scalp very superficially. Do they have different colors or different mix or something?
So the standard ink is the black ink, and then people get a little bit scared. They're like, "Oh, but I'm blonde. I have strawberry blonde hair, or I have we actually have a standard set color, which is just black, and we just dilute it and match your hair follicle color, the color of your follicle. And we do sometimes use a red ink, which is like a brown ink, to match the hair color, but we don't really recommend it.
Do they change color?
Well, a lot of SMP artists say it doesn't change. It's going to look exactly the same, but what I've seen... they do change. And it really varies on your scalp also, your scalp condition. I've seen amazing work on my clients who take really good care of their scalp when their scalp is hydrated, when they are taking care of it, there's no flakes and it's just a smooth, beautiful surface. Then the follicle, when we replicate a follicle, is absolutely crisp and it's stunning. Beautiful. But when you have dry, flaky skin, we do get a blowout sometimes. And it's kind of like if you drop a paint on a smooth paper, it just kind of like drizzles down and it just doesn't make a mark. But if you drop a paint on a dry textured paper, it kind of blurs and it spreads, and that's what happens to the scalp as well. So I always like to tell my clients, please take care of your scalp before coming in before the treatment for the best results.
So they need special care before, they need special care after?
Special care before is very simple. Just drink a lot of water, keep yourself hydrated. If you have flaky skin, treat it. Nizoral, the anti-dandruff shampoo that you could find in any pharmacy in UK, is very good. It's very effective. I have very flaky scalp, and I use it once or twice a week, and it just disappears. So that's a good way to prep your scalp. And if you do have a shaved head, I always tell them to moisturize with a thick cream.
You mean people don't come with shaved head?
So I work with clients with shaved head and long hair like us.
Okay.
That wants to add a bit of fullness.
So you can do with long hair too?
Yeah.
Oh, cool.
Most of my clients, 80% of my clients are female, and they do have hair. And yeah.
Cool. Does it not get in the way?
It does, but we have a divider
Oh.
that we have to like divide every time. But yeah, I like working with clients with long hair. Actually, it's quite fun.
I find that if you have long hair, you're working on a scalp, it's kind of like
Hard. It gets in the way.
Yeah, it gets in the way, and it's like
gets in the way.
sometimes you want to determine which direction it is, and it's tricky. And of course, our work may be a little transplant is a little bit more oozy, and you try to make
transplant is very different to SMP, so I can understand.
Those who think about having long hair transplant, thank you very much. We don't do long hair transplant in here. Thank you. So back to the special care for the. So after the SMP, how will the area look like? Is it going to look like kind of
for a few
red?
hours? It will be red. But I always tell them, don't be scared. Like it's only natural. We're poking thousands of dots onto your hair with needles, so it's going to be a little red for a few hours, but they do go down. Within an hour.
And do you you don't wash it, or you wash it, or
so we actually wipe it down with the cleansing mousse. It's a special cleansing mousse for the SMP, and we do advise the clients to not wash their hair for 48 hours, just in case. We don't want any sort of complication. Aftercare is try not to work out for 7 days.
7 days. Okay.
At least 7 days, because we don't want to sweat out the ink. Yeah, no sauna, no steam room, things like that.
Cool.
Just avoid sweating in general. Yeah.
So do people have like the SMP treatment? Is it just like a one pass, or is that you need a multiple pass? How does it work?
You need multiple sessions. Obviously, it depends on how severe the hair loss is. For clients who want a shaved head look, we usually on average we go for 3 sessions. So the first session is basically we're mapping out the areas, we're drawing the hairline a little bit, but it's very gappy, and we want to do it like that because we want to see if the needle size is the right size for the follicle. We don't want a needle size that's too big.
So you have different needle size for different purposes? Or?
And I think that's really important, because I see some great work online on Instagram and everywhere. The work that they do is great, but the needle size that they use is too big.
Okay.
And I just don't want people to be fooled by pictures, because once the SMP heals, the dots do expand double size.
Okay.
Yeah. So in pictures, it looks perfect. But when the dots get bigger, that's when it can look a little bit bluish and a little greenish.
So the look when it is newly done, and the look has it healed, or it can vary a little.
Yeah. When it's freshly done, it looks super crisp. After it's healed, the dots will get a little bit bigger. So that's what we want to do. We do a first session. We do with the standard needle, which I use is at 0.18.
0.18, that's tiny.
Tiny needle, yeah. That's the standard needle that I would like to use.
It's almost as close as the how is like the size of the hair itself.
Yeah, exactly. So just in case it's too big for the natural follicle, I would like to use something smaller to begin with and see how it works and how the skin takes it. And the second time we go around the dots. If the clients are okay with the needle size and the ink color that we chose for them, we go and fill in the gaps to make it more denser on the second session after it's healed. And the third session is when we perfect everything. There will be areas where it's patchy, where the scalp hasn't taken the ink very well. So that's when we perfect everything. That's when we can also decide if we want to lower the hairline a little bit with the client and adjust from there. Yeah.
Oh, cool. So what happens after the, let's say, first session you work on that? So they need a little bit top up in the long term, or it just stays on?
It's permanent. SMP is permanent. Classic SMP is permanent. I have seen I've seen works that was done like 7 years ago. And it's still there. Some people like to top up because they want it to look extra crisp. They want more texture, because after time it can fade a little bit. The colors will naturally fade, but it won't disappear. Yeah.
It's always there.
Yeah.
So talking about disaster, we look on social media, always come up with disaster, all sorts, disaster of a chair transplant, disaster of
I've
SMP.
seen so many.
But that's more really the level of practice. Someone who is not sure what they're doing, or
I also just think it's eye for detail and obviously the techniques with their hands and stuff like that. I've seen SMP artists advertising online. You know, I've been doing SMP for 10 years and their work looks questionable. So I'm just like,
we need that special sign effect.
Yeah. So it looks very questionable. So I don't think it's to do with experience. I mean, I've seen some people who's done it for maybe a year and they have really great skills and, you know, they just have that natural talent. And I think it's very important to meet an SMP artist who knows like the harmony of your face and like the hairline, who knows, you know, which hairline you should go for. I've seen some Caucasian guys with a very low and straight
Sometimes
shape up.
They come a little bit forward on the hair upon to square that
like
opposite.
The hairline, you know, it's very important to find an SMP artist that knows like the harmony of your face and the hairline and everything like that. I believe,
When is like a good time to consider SMP? Because when I see my patients, when they come and see me, they usually have this already fixate. Maybe they have an idea like, you know what, I'm receding on the hairline. All the other places got good hair. We're just gonna restore the hairline there.
Area.
And some of them was thinking, well, what's the difference between SMP and transplant? You and I know the difference in there and the sequence. What would be a good kind of a sequence in terms of treatment and things? Should they do SMP first, medication first, or
I think it really depends on what the patient prefers. Like if they're okay with going through a hair transplant and they're okay with taking some time off work and going through it, hair transplant is great.
Thanks.
Yeah, I mean, it's real hair. But sometimes, you know, there are clients who don't have enough donor
resource.
So that's when they come to me, or you know, clients who has had hair transplant done but they don't have enough to go through second or third surgery.
Because you can also help them in
with
the
scarring.
SMP with the donor area, scarring on the or you know, the entire scalp can get SMP treatment, right?
Yes. So I do scar camouflage as well for anyone who's been through an accident or who's gone through an FUE or a FUT transplant surgery. I do offer free scar camouflage with all your clients, but cool. I've not seen any scars on their work. So I'm just like looking at this scalp. I was like, are you sure you got it done? Or did you not get it done? Or did he just send it to just send you to me? But yeah, FUE, FUT, scar camouflage, SMP is really fun to do. I haven't done it for a while because all the clients that you send me is just masterpiece.
Thanks so much.
But yeah, we do overall. So back to the question is, so if they don't want to go through the surgery and they want fuller, denser looking hair, that's when they come to me. Yeah, it's instant results. You do need build-ups, but once you get a first session, you will see some sort of results.
In between the sessions, it's not too long, right? It's not
1
like months
to 2 weeks.
So.
It really depends on how speedy you want the process. I have a lot of clients who flies in and out a lot. So I say minimum 1 week. But yeah, 2 weeks is a nice...
In 2-3 weeks, that they could have done 2-3 passes, and that would get them to quite a good level.
Yeah, I mean, I say minimum 3 sessions to see visible results. But it really depends on how severe the hair loss is. So for people like us with hair, who has maybe minor hair loss and they want to fill in their scalp a little bit, that's visible, they do... I do recommend hybrid SMP, which is the KSMP, the Korean SMP, which is 3 times more effective as the classic SMP.
Oh, wow.
Instead of staying in the chair or the bed for multiple hours, for 5 hours, you could get the results in 1 hour.
Oh, wow.
So that's the SMP treatment that I recommend for clients who have long hair. because to blend in the natural hair with SMP, you need a lot of dots. You need to replicate a lot of follicles. And with that, takes a lot of time. Yeah. To do it with individually with a classic SMP. So we have a special machine that does that. Yeah.
Oh, cool. So the KSMP, tell us a little bit more about that. It's a bit different to the classic, right?
Yes, I believe we're the only clinic that offers this treatment. So we have classic SMP, which everyone is aware of. And then we have hybrid SMP and airbrush SMP. Hybrid SMP, like I've said, is 3 times more as effective than the classic SMP. It's a single needle technique with a different machine. So it's a lot faster. You see a fuller looking results within shorter time. Airbrush SMP is done with 12 needles.
12?
That could be a little painful.
Okay.
That could be a little painful, and it is a rolling machine. So it's kind of like literally like an airbrush.
Okay.
It's like fine dust because it has 12 needles working on the area. But yeah, that's more for clients.
Does the amount that it delivers differ as well, or the ink it delivers does it deliver differently? Because airbrush, I'm just thinking.
Yes, it's a lot lighter. It doesn't go in as deeper than the classic or the hybrid SMP. That's why that one we do for semi-permanent. So clients who prefer a semi-permanent results, we do offer. So
does the result looks somewhat because the techniques a bit
more.
different sort of techniques, and the result differs a little, or differs
it covers a lot more faster. So you will see a full coverage on the first session.
Sounds very good.
Yeah, but there are downsides to it. So if you have hair, there will be hair getting in the way. So it can be patchy. That's why you need 2 or 3 sessions to
check the
the spotty areas. Yeah.
Oh, and which one would you recommend if someone, let's say, to you typically my patients maybe receding hairline, we fix the hairline with the transplant, and sometimes they think, oh wow, it's a little bit lighter because with transplant it's difficult to get to 100% of density there.
Yeah.
So which one would you recommend? The
for hairline, I do recommend hybrid because you need. For hairline, I do recommend hybrid because you need a lot of fine dots everywhere. So I think within 15 minutes, that's going to be completed.
Oh, wow. Cool.
For classic SMP, I just very strongly recommend it for people who wants a shaved head look because we really need to manually place the dots ourselves. With the hybrid, it's the machine that kind of does it for you, that overlayers. Yeah.
Cool. So it sounds like different sort of area needs different sort of techniques and style
and
in there. So we see a lot sometimes my patients tell me like, doc, well, shave the hair and I can see the little small hair gaps in the donor. So
with
those
your work?
Yeah, sometimes we see that. I mean, definitely I can see when I shave them for the second transplant.
But
really? often they don't shave it that short, but sometimes. But maybe it's me looking at it.
Yeah.
So
I've seen some very questionable work
from
Turkey.
Oh.
Yeah, like a 500-pound work from Turkey. I see little pubic hairs growing on people's scalp. It's just like they have dead straight hair and I see just one curly stuff coming out. I'm just like, where did you get this done?
They call it body hair transplant, is it?
I don't know. It's someone's leg hair or pubic hair. I don't know what it is.
So sometimes when you take the hair from the donor, there may be a little small hair gap or a little small dot, or depending how the healing is. So what do you do with those? Do you because I've seen some of your work in there. So sometimes you can imitate
the length.
Yeah, what is that?
Depends on the length of their hair and how short they want it. If they want to shave their hair every day and keep it super short, then we replicate a follicle like a dot.
You mean you replicate with the SMP as is like a hair?
Yes.
Oh wow.
That's what SMP is, Mark. We replicate hair follicle. That's what SMP is. So if it's like a normal standard guy who just shaves his hair and lets it go for a few days, we do imitate a hair stroke. Matches the length of their hair length. Yeah. That's what
So
we do.
the hair stroke, is it more difficult to do?
It is because we don't know how thick it's going to turn out like. But it's very
I've seen some of these on
my
your
Instagram.
your channel. It looks phenomenal, and
thank
especially
you.
some of the FUT strip surgery scar where they have a feel like quite a gap. You can see,
Yeah.
and sometimes the direction can change.
Yeah,
a
so we
little.
really look at the direction of their hair strokes.
Can you actually do that in other parts of the scalp, or?
We can, but I don't recommend doing it. If it's for like, I've seen some people doing hair strokes on the hairline, like the receding hairline. I've seen some makeup artists, like permanent makeup artists, drawing strokes of hair onto the people's hairline. That I don't really recommend.
If you change the style, the stroke is still there.
Yeah,
right?
exactly. So to me, it doesn't look natural. I've seen people with it. When we move our hair naturally, we want everything to move. Otherwise, it's just like few
solid line
lines.
there.
Yeah, that's what makes it not natural. But if you do a SMP hybrid, it's like tiny little fine dust. So it just looks like a layer of your skin. Yeah, a layer of like a baby hair.
It sounds like it's needed quite a artistic eye to the degree of to line of work.
I did study art. So I'm very talented with my hands.
Oh, good.
So,
Wow.
yeah.
So how do you got into SMP?
SMP is super popular in Korea.
Yeah.
So not only for clients with hair loss, but people like us who have full of hair and sometimes in pictures or certain lightings, Asian people are they're perfectionists. So when they look at themselves in a certain lighting or they take pictures and they feel like, oh, my scalp looks a little too white, they get SMP
It
done.
sounds like me. It was a little scalp.
Like, even like me, I dyed my hair recently to light brown, and I'm seeing myself in my bathroom light. I'm like, am I balding? So it's very natural. So yeah, in Korea, everyone loves to look perfect. We definitely have this image of trying to look beautiful and be perfect in every way. So yeah, Korean SMP is very popular in Korea. So I thought it's a very good idea to bring it to London because a lot of people struggle from hair loss in the UK with the harsh water and stuff like that.
So most of your patients, a portion of your patients, ladies, females,
Yeah, a lot of
and
females.
and so they have longer hair, and they what are the main sort of issues for them, and what are the main sort of challenge?
Just, I have a lot of clients who are Muslim and they wear headscarves. Surprisingly, you would expect them to not really care about hair loss because it's covered whenever they're out. But when they are at home, they take it off and they see themselves and they really hate themselves. And that's when I started to really connect with my female clients and I really wanted them to feel great about themselves. Even if they're hiding, I want them to feel great.
Cool. No worries. So let's talk a little bit about. Can we have a look at some of your beautiful work?
Yes,
Let's
of
look. Oh, that's long hair there.
Yeah,
Let's have a look.
patient with the longer hair.
Wow, look at that. This crown, look at that. It's almost like a transplant result. Guys, look at this. This is almost like a transplant result. Can you talk us through this? This patient has got quite a big area of hair loss in the crown.
So he did 2 sessions of hybrid SMP. So we wanted, because he has hair that we need to blend it in with. A classic SMP would take too much time, and it wouldn't conceal so well. So we did a hybrid.
This is the hybrid one.
Yeah, so it's a lot more effective, a lot quicker. He was in and out within an hour.
Wow, this is in an hour?
Yeah.
Oh my, look at that. This is in an hour? Oh my God, we're going to question ourselves while we're doing hair transplant.
So if it was done by a classic SMP,
looks amazing.
It would have taken about 4 to 5 hours to complete this.
Wow, this is and this is long-term result as well.
Yes, this is permanent.
This is beautiful. I've seen some videos that you were doing it. Can we have a look?
Yes.
So some of the results, was doing it manually. And so, this is Sue at work. Let's have a look. So this one is the classic one,
This is the classic one where I have to individually place the dots, and this is the airbrush SMP.
This is fully awake and
Fully awake, yes.
no, you're just sitting there, right?
Yeah, they're literally scrolling through the Instagram. We watch Netflix.
wow.
We in our TV with.
Look at that.
And this is the airbrush, which is more of a rolling technique with the 12 needle.
Oh wow. And that does it get washed off or?
Yeah, we do wash it off. It's like a thin layer of hair fiber. So I get a lot of.
I mean, when it wash, does it the color goes?
It fades.
It fades
course.
a little
Yeah,
with time, or
no. So when the ink goes in and out, obviously the ink splashes onto the scalp, so it can look darker.
yeah.
So people love it. I'm like, oh my god.
Yeah.
You know.
Covers the area.
Yeah. I always tell my clients, don't be so disappointed when you wash off your hair, because the ink that's staining on your scalp, the splashes, they will come off, and you need a few more sessions to build it up.
So how many wash would that last? Like a wash?
I do advise my clients to not wash their hair for 48 hours, just so the ink really stays in there.
But it stays after that, or it washes back to normal? Or?
No, it's permanent.
Oh.
Permanent.
Cool.
But obviously the ink that splashed outside
Just
on
the
top of the surface that will be washed, I think you would need a good few washes to take that out there.
Okay.
Yeah.
But
'cause the ink
even
gets a little
after
dry.
that few washes, they still get the improvement from that, right?
Yes.
Cool. Sounds amazing in there. So, what would you say to someone who is considering SMP? Because this, I mean, I look at SMP. If I search SMP, I would have absolutely no clue. I'm so glad I know you. But you know, what would you say to the patients who are searching for SMP? What to look out for on that? Let's say if someone is looking for SMP treatment, what should they look out for when they're researching? Just go to the cheapest one.
Oh my god, no! Don't go to question. Just question if they quote you too cheap. You know, I had a client who came in and she had I had full of patches, and I'm like, oh my god, what happened? She said, oh, this girl, she said she'll do it for £200. I was like, and you went to her house and paid £200 for this. You need compensation. To look out for, if they say they could make you look like you have full head of hair in one session, that's a red flag. We'll call it a red flag. When the quotation is too cheap, or if they're too pushy, red flag. If they're obviously before and after pictures is super important. If they're please look at their work, their hairline, and the key point that I've mentioned, also the needle size. If the dots look perfect, a little too perfect, or it looks big,
in real life it's probably a bit big.
Once it's healed, it's only going to get bigger. So I think that's very important. Find an SMP artist who can really match the hair color, the follicle color, and the needle size.
This needle size, can we talk a little bit more on that? Because I feel like it's kind of...
I feel like I shouldn't have even told you what needle size I'm using. I feel like all my competitors are going to use it.
We have to cut that out on that one.
We cut it out. We cut that one out.
So this needle size, when it is smaller, does it make it more difficult to do?
You will need more sessions, because in a huge surface, and if you have tiny little dots, you need tiny more little dots to go around the gaps.
So it's more time consuming to work on there.
And for clients, it may feel like, oh, it's not getting anywhere. Trust me. I always tell the clients, trust the process. You don't want to rush things. If an SMP artist says, oh yeah, you'll be done in 3 or 5 sessions, or 1 session, you'll be fine. No, after you washed out the ink, it's barely going to be anything there, unless you spend 10 hours in the chair.
So this small needle, you get, it's actually better result, is it? Or?
Yeah, it's more realistic. You want it to look, when it's side by side, you want it to question, is that my real follicle, or is that a replication?
Wow.
Yeah. I'll show you a picture of an example, actually. So this is how small.
Oh wow, it's tiny.
Yeah. So once it heals, it's going to get a little bit bigger. But this client, she had very thin hair. So that's why we had to really work with a small needle.
It's hardly noticeable
Yeah.
there. So this is one pass or
This
three.
is-
It says 3 there.
Yeah, 3 sessions of hybrid.
Yeah. Wow, it's very small. This is already enlarged, right?
Yes, enlarged.
So that one there was a little bit more refined
Yes.
there. So this is freshly done.
Freshly done.
Oh wow, it's hardly noticeable.
Yeah, and this is once it's
A couple of sessions.
So you can see how the dots gets a little bit expanded.
Still very small.
Yeah.
But I see your point. Is when it is freshly done, it's a little bit smaller, yeah.
Yeah.
And then time gets a little bit like a little there. Yeah.
Kind of. And for hairline also, if you
Oh, wow,
have
looks
full
nice there.
hair and you just want to fix the lines of your hairline, we could just do the
Looks
hairline
beautiful,
as
guys.
well.
Look at that. Looks awesome. This hair.
Yeah, he had a pretty good hair in
Yeah,
general.
that looks beautiful. Not my work though. Sue's work. So look at that. It looks amazing there, and it's hardly noticeable. And that even when you zoom in there, it's hardly noticeable. There, it's
Yeah.
very natural. Great work, Sue. It's very natural in there. Beautiful. So, do you just do scalp, or do you the other parts of the?
We could. I don't do brows.
Mm-hmm.
Brows is completely different. I do beard as well.
Beard?
Facial hair.
Oh,
Yeah, it's very much like the FUT and FUE scar camouflage
Mm-hmm.
with the strokes for people who has.
looking for a
Less,
beard.
yes.
No. So do you? I know some people do beard hair transplant as well.
Yes.
So do you do combination with them or?
I don't.
No? Yeah.
I don't actually. Yeah. I don't really get too much beard requests.
Okay, cool.
Yeah.
Maybe it's not popular this season, but
Yeah.
maybe after the summer. Cool. Well, it's so great to have you in here, Sue. And we look at some really good work in there, and we got a better understanding of SMP and uniqueness there. So if any one of you needs any help with the SM, please reach out to Sue. And it's great to have you in here.
Thank
Thanks
you so much for
much.
having me.
Thanks.